Okay, good morning or good day, everyone. My name is Heli and I'm the project manager in SIUN SOTE project, which is our area's leading project to improve our healthcare and social services. And today I'm supposed to make a presentation for you about our good practice. And if you have any kind of questions during my presentation, please ask. I try to answer them as soon as possible, but maybe we have some time at the end of the presentation to discuss more about this SIUN SOTE. The name SIUN SOTE means kind of direct translation in English is your social and healthcare services, but the word SIUN is not a direct translation in English to Finnish. It's a North Karelian dialect, and it means yours, but it's a kind of a warm word we use in our area. It's not a written language, it's a dialect. And SIUN SOTE is also kind of a trademark for our project, and it's now known nationally. And for example, our Minister of Health and Social Services Affairs has been using us as an example many times. But let's begin. I know that many of you know something about our region, North Karelia, but there is some basic elements about our area. North Karelia is in eastern Finland. We are the most eastern point in whole Europe, and we share a border with Russia. I don't remember how many kilometers, but many anyhow. In our project there is also one municipality from Savo, which is another region in Finland. It's called Heinävesi, and it's with us because it's not the Joensuu, which is the center of North Karelia, is nearest city to Heinävesi. We have a lot of older senior people here, and one problem is that the old age dependency ratio is higher than the average in our country. I think we are going to be the oldest region in whole Europe soon if there is not going to be any change in this tendency. We used to have a migration away from our area maybe a few decades ago more, but now the population growth is going to turn around. Of course, we have a lot of old people who are dying, but we also have some people to move back to North Karelia. But the birth rate is quite low. For example, the municipality of Heinävesi, which is quite a small municipality, there is only about 2,500 inhabitants. There is about 18 babies born in every year, which is quite few babies. The smallest municipality, Rääkkylä, which is a very beautiful word in Finnish, the birth rate is 14 babies born every year. The center of North Karelia is city of Joensuu, and it's growing city, and we have 75,000 inhabitants, and it's the 12th largest city in Finland. And we also have 4 other towns in North Karelia, but they are rather small. Lieksa and Nurmes, they have about 12 to 13,000 inhabitants, and Outokumpu and Kite are smaller than that. Then we have 8 municipalities which are considered to be rural municipalities. That means that the population is living in a quite wide area. The share of rural settlements in North Karelia is higher than national average. 56% of our population lives in the area, which is considered to be rural. And that's one challenge we are facing when we are trying to provide and produce our health and social services. Why did we build up this project? There is few ground or basic rules or basic facts that we have to face if we are going to at least trying to achieve this level of services in the future, or maybe even better some services. And of course the aging process is one. Our population is aging rapidly, very rapidly. We have especially small municipalities like the Rääkkylä and Heinävesi I mentioned before. They are already struggling to produce and provide services their population are needing. And then we have this problem to recruit competent and qualified personnel and organize some services, for example, emergency duties and sometimes even long-term care. We are lacking some doctors and dentists and social workers especially, but we are also having problems to provide care for elderly people in their homes. And of course we have this regional reality. We have a long distances from place to another. For example, from the southeast point, which is Kesälahti, to the northeast point, which is Nurmes, I think there is about 250 kilometers length between those cities. And that's something we have to consider when we are thinking our services. This good practice of SIUN SOTE, well, I don't know yet how good the practice will be, because we are making that right now. But few words concerning the history of this project. It started about a year ago when our decision makers in our municipalities, there is 14 municipalities within this project, our decision makers decided that we are going to collect the information concerning our areas, healthcare and social services, and we are trying to make a joint authority and a joint municipality authority to provide and produce services if it's wise decision. And right now we have made this kind of a research phase. We are ending the research phase, and we have the information which is given by our citizens and workers and our decision makers, and it concerns our services. We have been describing the reality today, how our services are working and how they are lacking to work, how they are not producing people what they need or want. And right now we are in the phase to make the real decision whether or not we are going to make the new joint municipality, which is going to be one big employer for 6,000 workers in healthcare and social services, which provides all the services and arrange all the services in our area. Till these days it has been a project, but if the municipalities are making the decision to make the new joint authority, there is going to be a whole new organization in Finland, quite big one. I'm the manager in the project which is dealing with the functional integration, which means that I'm trying to improve our services, the way our inhabitants and citizens and service users are needing the services, the better the services, the way people want them to work. Our project organization is quite low, I'd say. There is only 2 whole-time workers in our project, me and our ICT specialists, but we have workers, we are calling them development workers. They are people who are working in social services or in healthcare field, but they are doing actual client work with the actual patients and clients, but they are also at the same time, besides their own work, they are trying to develop the services somehow. For example, we have this development worker who is trying to prohibit the falling down. You know, when the old people are often fell down, for example, they don't eat enough and they have their balance is not good and they are falling down, for example, from the bed or just at the floor, and then there's going to be severe injuries. These kind of injuries can be prevented if we are doing right things. For example, we take good care of our old people's nutrition and muscle balance. What I think it's distinguished feature in our project is that we are trying to develop things with the bottom-up approach. We have this participation of workers and citizens. We have, for example, collected 1,800 feedbacks from our citizens. What do they think about our services? And we know what are the main problems now in our system. One of the main problems is that people don't get the service they need. For example, they can't get through with the phone to see a doctor or to get a doctor's appointment. They might, for example, try 2 weeks to try get through the phone lines with no luck. And this is one thing we are trying to change. We are trying to improve the accessibility to services. But also we have some other main problems. For example, people think that they're not always getting a contact in the right way with the professionals. Some people think that they are treating badly or impolitely within the services. What I think is also important in or what I think is crucial, which makes this maybe a good practice, is that we are very committed to this. In North Karelia area, there is 160,000 inhabitants, more or less. And of course, we haven't asked the commitment from everybody, but for example, the leaders of our municipalities, 14 leaders, are very committed to this work, and I think also our workers are really, really committed to this work. I think this commitment is something exceptional. I don't see a lot. Of course, we have different opinions and we have a lot of discussion, and I think it's the way it should be, because this is a very important issue we are dealing here right now. But still, I have to raise this commitment thing above other things. Then I think, which is also important, is that we have a will to do things differently. We have a will to do something about our situation. Finland is right now, I think we are facing the most severe finance crisis within 20 years. The last one was at the beginning of 1990s. And I think we have I'm not sure if we have already really understood how bad things are here, and we have to do something. Our social services costs are increasing in North Karelia. They are increasing every year about 5%. And in the future, we have to try to make this percent to be 1.2, which is quite a huge change. Why these costs are increasing, main fact is that our population is aging. They need more services. They're using more doctor services. They use more home brought services. So the costs are going to arise anyhow, but we have to cut them because we simply can't afford it. That's a very sad thing, but I think it's something we have to face if we are going to go through this crisis. Okay, let's go to the next slide, which is objectives. Right, I'm telling you something we are trying to achieve, and these are quite general objectives, I think, but maybe I can say to you something about how we are going to measure the objectives we are trying to achieve. First, our objective is that we are trying to get the citizens' participation within the services processes more solid, and we are trying to get people more involved into the developing the services. In Finland, the rate of voting in municipality elections is going down every election, which is in every 4th year, and we can say that the democracy is in crisis as well as the economy. And that's why we need new forms of democracy, for the near democracy, that we have the people who are using the services or paying the services with the taxes to involve more in developing these services. It's maybe a provocative way to say that, but I'm saying it anyway, that we are, sometimes we have been forgetting to whom we are making these services. I think this is something we have to remind to ourselves every now and then. We are making the services for the users and the payers, not for ourselves as a workers. But the citizens' participation is one of our main objectives. In the future, we hope that we have citizens' councils in every services sectors, and we have this quality clients who are trying to evaluate the quality of the services. The other main objective is that we have to improve our system of services, more responding to the needs of the citizens. They have to be more cost effective. There is this evaluation that 5% of the service users are using about 68% of the cost of the services. And that tells us something. Some part of those people are people who are, for example, very severely injured, and we can't really do nothing about the costs. But some of these users are people who are needing or using a lot of services, but nobody is kind of coordinating the services with them. For example, families who are clients in child psychiatry and children services. And we have to know who these clients are. I don't mean that we have to know the persons, but what kind of clients they are, and how we must change our system that these people are going to be faced better in our system. Then one objective is that we have to expand and make new forms of expertise that enables more multi-perspective way of working. Finnish social services and healthcare system is very professional based right now. If you are a doctor, you are a doctor and you do your share. If you are a psychologist, you do your share, but nobody is coordinating the services for the people. And for example, if you have a lot of problems, if you're, for example, a young person and you have a lot of problems, there might be even 30 professionals in your life, and you don't even really know why they are in your life. And that's not very cost effective or very client friendly approach. Of course, then one of the main objectives also is that the technical applications, we have to make them more part of the processes, because we have this long people are living in the rural areas quite near from example. We only have one hospital, which is quite a good thing, I think. We don't have these area hospitals. We only have a central hospital which can provide, for example, most of the emergency care we need in our area. Only few clients have to be sent to Kuopio or Helsinki. But we have to try to get these technical applications to the rural areas especially, but also to the services for the people who are coping well. For example, you can, in the future, we are hoping that everybody could take their blood pressure at home, and the blood pressure will go to the system only with pressing one button, so that for example, a nurse or a doctor in their office can read your blood pressure level and make the changes in your medication, for example, if needed. This is quite a simplified example, but that's basically what it means. These technical applications and technical novelties are for the people who can use the computers, who can use the mobile phones, and who are willing to do that, and who also have this infrastructure to use these kind of ways. Of course, one of the problems we had is to recruit the competent personnel, so that one of our objectives is that we want that our personnel in the future feels well, they are highly motivated, and they are very engaged to our area. We are, when we share these recruiting processes, then there's not going to be, for example, moving to another municipality to another because of the higher paycheck. For example, social workers have been doing this recently, even though the paycheck is not that big in other municipalities. But this is going to make people more engaged to our area, because they know that they have a big employee behind them. They can change their work if they want to within the one employee, and they don't miss their privileges they have achieved this far. But as you can see, these are quite huge objectives, and they don't really tell so much in reality. With whom we are working right now, of course, we have these municipality members and citizens and user of the services. In Finland, our services are financed by the taxes collected by the members of the municipalities and by the government. The government and the municipalities can collect the taxes from our citizens. But of course, the payer is not necessarily the same as the user of the services. We have two ways of participation we have to face. But the citizens of our area are the main stakeholder, I think. Then we have this approximately 6,000 workers in our area in social services and healthcare. I think that's quite a lot. I think that's enough if we do things effectively. And this is something we have to try to keep within the future years, because there is going to be a huge amount of people who are getting their pension within next 10 years. I think it's about 1,500 or so. So we have to really think about the things that how we are getting people to live here and stay here, and also how we are going to do things differently so we have enough people to provide these services. Then we have this Ministry of Social Affairs and Health. It's funding this operation. Then we have different kind of other organizations, for example, Regional Council, University of Eastern Finland, and Karelia University of Applied Sciences, and National Institute of Health and Welfare. These organizations are, for example, evaluating how we are going to succeed or not in our project. Then we have other projects which are quite similar to ours in other areas in Finland. We all have these same problems in Finland too. We really have to make our services more cost effective in every area in Finland. But North Karelia have these special features, for example, because we have this rapidly aging people here. But these are the main stakeholders in our project. And as you can see, it's also quite overwhelming. Okay, let's take the next slide. We have a few minutes left before discussion. This was kind of a hard thing to think what would be the distinguished characteristic and features in our good practice, but I lifted 3 things above other, and I think one is the openness. Of course, you can always try to do this open government or open developing of services more better, but I think we have succeeded within this far. And this is something we have getting feedback of, sometimes good, sometimes bad, but we are trying to be as open as possible. And that requires, for example, that we have resources in communication and kind of it's not really a marketing, but in communications, human resources and money in communication. What is other distinguished feature, I think, is this saying we have. We are in Finnish. It calls SIUN SOTE lupa kehittää, which means SIUN SOTE license to develop, like the James Bond license to kill or something. But this means that developing services, developing one's work, it's not somebody's. It's not something that the developer worker can only do. Everyone has 2 jobs. The basic job you are doing, for example, as a nurse, but the job as a developer, you have to improve your work every day. You can make small improvements in your work every day, and you don't have to ask anybody a license to do that. And I think that's a huge change in our attitudes and thinking, because in Finland, I think the structure is kind of that we have these workers and then we have these developers, and the developers think that things should be done better, and they are telling that to the workers who are doing the things. But in the future and already now, everybody can do the job better. We are using, for example, lean processes from the Toyota factories as an ideologically ground in these small improvements thinking. And I think one main features here is also the cooperation and companionship with the third sector and NGOs. I think this is something we have doing differently. I'm not so sure how, why this is different compared to our other areas. Maybe because we have in our area, NGOs has this quite solid ground. They have this joint authority too. They have these organizations. They are trying to get their voice heard in our society. But this has been going on very well for from the beginning of this project, and this is going to be very close to the future too. And of course this includes the citizens, but this is something more too. I think the third sector is going to be very important in providing the services in the near future, but also to collect the information how things should work within this field. I think these are the most important things, and which kind of differs this from the other projects. Okay. Then we have this next slide, critical success factors. Of course, we haven't been evaluated through yet because we only started this project actually started at this functional integration project. I mean, started this March, and we have been going on just a bit more than a year for now, so we don't have been evaluated truly yet, but already we have seen few factors which are essential or actually critical if we are try to succeed what we are trying to do. First is this communication. We have to understand, or we have already understood, that we have at least 4 different kind of approaches we have to think through. First is the citizen or client approach, and I remind you that this is not the same thing. We have citizens, and then we have this service users, and we have to communicate with them successfully if we want this thing to work. Then we have this communication with decision-making processes in Finland. Within the municipalities, the decision-making process is, well, from my point of view, quite bureaucratic. We have these parliaments, and we have these councils and governments in each municipality, even though they are small. For example, this Rääkkylä with 2,500 inhabitants. But the decision makers are in a center right now because they are deciding how much money they are going to use in social services and healthcare services, and how these things are going to go from now on. Then we have this 6,000 workers personnel, and of course this changes in our field is something to do with the everyday working life, and it's very important that we have straight communication with them, and people think that they can say what they think, and their opinion is taken into consideration, and how do they feel about these changes. Then measuring, I think this is something new because until these days, measuring in Finnish social services and healthcare system is really based on how much the services are used. Actually, how often the doctor's door is opening, and it's not right way to measure how the services are working. We have to find new things to evaluate services in a quality way of thinking and within the quantity method of thinking. How much money we are using, but also how effective really the services are. This is quite, I think this is quite difficult thing to do because there is not mittari. I don't remember the word in English. The scales. We don't have the scales ready for us. We have to try to find the right scales, and we also have to take the quality of the services, the experience the clients have within these scales, and it's not very easy to do because it's not just numbers. One thing I think it's which is already been seen as a success is that we have recently understood that we already share quite a long history of shared developing. For example, we have in healthcare services we have only one client system in ICT. It's in a special care and it's in the basic care. So if the person goes to a nearest doctor in Joensuu, for example, in a healthcare center, the information goes through to the special care in a hospital right away. We have a shared system, and it's huge thing in our infrastructure, and it's not something in every area in Finland has. But we also have been sharing a lot of other developing areas. For example, we have this emergency social services we share. Every municipality are taking part of that services. We have, for example, joint emergency care in healthcare, which is also something they don't have in this way in other areas in Finland. And I think these are some ground blocks we are leaning on, and I think they are quite good ones. But I think we are running out of time soon. We have 9 minutes, I think, left. And if you have any questions, I'll be happy to answer them if I can.
Thank you very much for the presentation. It was really interesting. I have some questions. My question here is, are the services or are intended to be delivered only by these 6,000 workers that I understand that is the personnel that they are formal workers, or are you also involving other parts of the community, as for example the family of the people that maybe needs to receive the care services?
Okay, these 6,000 people are really the formal workers to the new joint municipality, but we also have a lot of small companies who are taking care of, for example, for the elderly people. In Finland, our society is based quite a lot, not so much to the for family-based care. In Finland, most of the women are working outside the home, and elderly people are usually taken care of by the society. And for example, if we have this small company who are providing the services for the elderly people's care, the municipality is paying the bill at least partly. And they are a huge resource for us too. We have this private sector also. And well, in reality, we are facing the fact that we should have our citizens, for example, the children of the elderly people, more involved to the care of elderly people, because I think we can't cope the way we have been coping this far. That's my opinion, I think, but we have to make some changes in our system, I think. I'm not sure if this answered your questions correctly, but
yeah, it answers, and that gives me the floor for the next question, if you allow me. And so maybe do you envisage, for example, that you want to involve more, of course, the community, and then maybe are you thinking, for example, of giving them some sort of training or formal training to prepare them for being part of the solution? Mm-hmm. Or not yet, or is something that is not planned for the moment?
Okay, our personnel has been involved in our processes already. For example, last autumn I met 600, about 600 or 800 workers in our area. It's not all, but I think it's quite a much. And everybody had a chance to make a comment to our plans. They had, at least they should have been a possibility to make a comments what we are planning to do. And right now we are planning, it's not really an education, it's not really a course, but it's kind of a mentoring process or mentoring program to our leaders who are near this client-based approach, near clients. These leaders who are not strategical leaders, but the leaders who are in the middle of hierarchy. And that is the mentoring program is, for example, you have to learn how to, if we are going to achieve our goal to put down our costs to the 1.2% in growth, which is quite a huge objective, our leaders have to understand how their decisions and the ways they are doing the work is going to affect to the costs. I think this is something we have to really improve in our country. But this program is also, we have the leadership is something that is going to change most, I think, from the bottom to the top, from the strategic level to the everyday level leading, to the operational level of leading. And then we have this mentoring program from them. But we also have these age-based services programs for our workers who are trying to improve their everyday work within the clients. For example, we have our healthcare services. In every municipality there is at least one healthcare center. And all of these centers are involved in lean-based improving. They're trying to make their system work better, especially in order to improve the accessibility to services so that the people can get to a doctor when they need that. That's quite, I think it sounds a bit ridiculous, but we really have a problem with that. And these are the main programs we have right now going on within our personnel. This question about the final political decision, it's going to take place at the 26th of October, not more than 2 months. And right now the political atmosphere here is that this is going to happen, I think. We have some political groups that are against, but not everybody within these groups are not against this. I think most of our decision makers have faced the fact that we have to do something, because if we are not doing anything, we have to face that almost every municipality is in our area are going to be so-called crisis municipalities within 10 years. Okay, now about the cost question. Oh my God, we have been thinking this financing system that 95% of the money taken into this system is going to be based on the how the municipalities' citizens are using the services, and 5% of the costs are covered by the capitals, how many inhabitants there is in your city, and that makes the system good for the municipalities which are small and where the people are quite old, and where there is working people and who are paying taxes, it's going to be, well, they have to pay a bit more, but I think it's quite fair. We have been trying to find this model which is which provides solidarity and which is oikeudenmukainen, which is fair to all our citizens. And this is something which is going to be under discussion within next weeks before the decision is going to be made. But there was this group who was thinking about this finance thing, and they have been working about 6 months now. And I think they have made a model that most of our municipalities can accept. Of course, not everybody is happy, but I think this is right now I think this is the best model we have in whole country. There is no other models. I think if we are going to be successful, I think some other areas are going to take this model into consideration. At least our Minister of Financing is very interested in this model too. But this model was just released 2 days ago to the public. So this is quite new for everybody here.
Excuse me, Heli. Can I have another question? I was thinking about this joint organization. I suppose it's going to be a central office. Where will that one be located? Will it be in the biggest municipality or biggest city, or how are you going to handle this?
Well, that's actually an interesting question, because one thing I lacked to remind before was that we haven't been drawing much of organization models yet. Of course, the central city is crucial because the only hospital lies in here, and some of the leaders are going to be here, but we haven't been deciding these kind of things yet. And of course, within the technical novelties, I think it's not really that important where you actually sit than or where your office is going to be. It's more ideological home you are part of. And one thing is something which is, well, for some personnel it's going to be difficult to accept that some workers in the future, some workers are doing more, they have to move more in the near future. For example, if you are psychology in the field of children, you might have to work in different municipalities in the future more, because there's not going to be enough clients in small municipalities, but the service is still needed at some extent. Okay.
I have a final question, if you allow me. Yeah, because to me it was really interesting what you were explaining about this license to develop, trying to encourage that the workers that are working in that they know what is happening, or at the end this can be applied to the whole range of public services. So at the end, a lot of times the power is in the worker that is actually delivering or developing a service. So if I understood well, what we are trying also is to encourage the workers to propose new ways to improve the way that the services are developed or delivered. And my question is also, how are you, let me say, canalizing, for example, all the proposals that you can maybe receive from workers? Are you using this lean management methodology in order to capture all the proposals or the improvement, and then governing this process, trying to maybe selecting the ones that are really improvements and then sharing with the other workers? Or I'm just curious about how do you envisage to govern the process? Because of course I see the point of receiving all the proposals for improvement, but also the second part where you maybe how you are going to introduce them or to implement them, and sharing with the rest of the people that maybe can use these new ways for a better public service delivery in this case.
Okay, we are already this lean lean coaching maybe is taking place already in some areas in our services. For example, in special care, for example, in elderly people's psychiatric department has been taking part to this lean coaching, and there is this small system basically based on post-its and everybody can make a proposal to one's unit how to make everyday life better, and they have already made those improvements. For example, in this department where there was psychiatrically ill elderly people were taken care of, there was this storage which was full of diapers. There was 100 of diapers in the storage, and other things they needed, people couldn't find them. And this thing has been going for years, and still they had only one patient at a time who needed diapers. But still every week somebody ordered more diapers. And somebody somebody noticed that, well, we have this storage full of things we don't really need, and somebody's getting them more every week. Should we do something about it? And then they changed this thing. They cleaned up the storage, and they ended to order the diapers anymore there. And then they have more room for the things they need, and everybody are happy because when they go to the storage, they find the things they need. This is an example of the small improvement, but which is affecting about 20 people's life every day. And these are the things everybody can say the opinion. Of course, not everyone are willing to take part in the developing processes. It's all right too. You don't have to be a developer if you don't want to. But the leader near the personnel, the supervisor, their role is really, really important in the near future, more important than it has been, to collect the ideas, to collect the proposals, how to improve, and of course people have to choose what to improve. You can't change everything at the same time. But people are really happy about these processes because they think that they can affect in their working life. This is not something huge somebody is deciding far away from you. This is something you decide here, right now, today, and it's affecting your work, and it's affecting your life. This is basically the idea we have in our developing. I could tell you more, but it could take more time. I think we have been here 8 minutes too long already. So, but if you have any other questions, you can of course ask them through for example, through Pia with the email. I answer them later if you want to.
Okay, thank you for this. Well, the 8 minutes are due to technical problems, so you're not going over the time.
Okay, it's fine. Thank you to you too. It was very interesting. This was my first webinar. Well, I was sweating a lot.
it went great. Well, it was. If not for the technical problems, it will have been perfect. But thank you all for being here. Thank you for the presentation. The next one will be on Wednesday, and we will make sure that the PowerPoint slides are available. Thank you for your participation and your questions. And I see that there's the email there. I will edit the recordings later today, and I will display the contact information and try to make this nicer than it went on screen. So if there are not any more comments, thank you all for joining and being with us.